Canada's so-called top doctor was privately forwarding Chinese news reports about a Wuhan disaster while publicly telling Canadians that there was nothing to worry about. We have the internal emails, and what they show is damning. Tam and her team were downplaying the threat, gaslighting the public, and even shipping Canada's PPE to China while Canadians were getting sick. It wasn't just incompetence, it was a deliberate mismatch between what they knew and what they told you. So let's dig in. By January of 2020, Theresa Tam, who was then Canada's chief public health officer, was already misleading Canadians about how close the COVID-19 virus really was. And we're not just guessing. Through rebelinvestigates.com, that's our exclusive government accountability website featuring access to information documents, we have the emails and the documents to prove it. Someone sent an email to Theresa Tam on January 7th, 2020, titled Chinese News Coverage of the Wuhan Disaster. And Tam took that email, forwarding it to her senior communications advisor, Anna Madison, at Health Canada and the Public Health Agency of Canada, almost gloating, writing your name in a Chinese newspaper. Madison writes back saying, "Thanks for sharing. I hope the coverage is good." To which Tam responds, "Yes, factual." The Mandarin written article by Ming Pao Canada, that's the now closed Canadian edition of the Hong Kong-based Chinese language newspaper of the same name, was flagging concerning reporting about flu season ramping up with unusually high numbers and reports specifically from Toronto Public Health of new cases doubling and seniors hit the hardest. PHAC's official response was to say that no similar cases were detected in Canada as they were being in Wuhan. No Canadian citizens were sick abroad, and therefore Madison said that no extra public safety measures were needed. Here's the translation of what that article said and what Tam's own communications people were responding with at the time. Regarding the unidentified respiratory outbreak recently detected in Wuhan, China, Hong Kong, and Singapore, the Public Health Agency of Canada said, so far, no similar cases had been detected in Canada, nor had any Canadian citizens contracted the illness abroad. Canadians traveling abroad should consult the government's travel advisories. Anna Madison's quote in the piece was that the federal government is closely monitoring the outbreak and working with provinces and the World Health Organization, sharing information through global networks. It sounds pretty reassuring, except that it was January 7th of 2020, and the truth was already staring them in the face for months. At least it should have been if they were actually paying attention and, doing their jobs. This is what Tam was saying just a few weeks later on January 20th.
The government of Canada is actively monitoring the outbreak of novel coronavirus that originated in Wuhan, China, and is in close contact with international partners, including the World Health Organization. While the risk of the disease spreading to Canada is considered low, the Public Health Agency of Canada is analyzing any potential risks to Canadians on a continuous basis. Currently, there are no reports of cases in Canada of this novel coronavirus, and we are not aware of any cases involving Canadians overseas. According to the latest information from the World Health Organization, there is evidence of limited person-to-person spread. At this time, there is no clear evidence that this virus is spread easily from person to person.
But wait a minute. Let's rewind to October of 2019. That's 2 full months before China even admitted there was a novel coronavirus to the world. Members of the Canadian Armed Forces were coming home from the Military World Games in Wuhan, sick, isolated on the flight with severe respiratory symptoms. It was perfect timing for the flu season, for any novel pathogen to blend right in. Canada's official 2019-2020 flu season kicked off right on schedule in mid-November, which is exactly when you would expect any novel respiratory bug brought back in late October to start quietly spreading through communities, families, schools, and workplaces. By November and December, a brutal wave of pneumonia-like illness and hacking coughs was ripping through the country. I remember it. At the time, I was bartending on weekends, serving Christmas parties while actively feverish and coughing because no one could cover my shifts. The cough was absolutely brutal, and I remember at that time several of my friends whose kids were usually robust and healthy, they were hospitalized. It was said to be the start of a bad season. That's what they used to say in the before times, the pre-COVID days. But Again, the timing lined up perfectly with soldiers coming home from ground zero. We've covered this extensively at Rebel News, including the internal military documents that tried to gaslight our own soldiers into thinking their risk was negligible. These were healthy, fit service members. They got hammered with what sounds exactly like what later became COVID-19. And the government's top doctor was still claiming in early January that nothing was happening here. With a salary of more than $300,000 a year and the full resources of Canada's top public health agency, are we really supposed to believe that Theresa Tam and her team couldn't connect these dots? If we look back at official records, it wasn't until December 31st, 2019, that PHAC's own Global Public Health Intelligence Network got the alert about the risk in Wuhan. They waited until the next day, January 1st, to notify key federal departments. And even after it was being flagged by Chinese media, Tam's team was still telling the public and the media here at home alike that there was no known cases in Canada on January 7th.
So there wasn't a lot really known, and this is why I'm concerned, because we've experienced SARS and we've experienced other outbreaks that could turn into something more serious. But at that time, you actually didn't.
Sure, hindsight is always 20/20, but what was Tam busy doing at that time instead? Scolding Canadians that their criticisms of the response and things like closing the borders would be racist or xenophobic, of course, and helping to tone police the name from the Wuhan flu to COVID-19. She was also responsible for shipping tons, literally massive shipments of personal protective equipment from here to China. 16 tons of masks, gowns, gloves, face shields, supplies from our national emergency stockpile. We sent it over while the threat was growing right here at home. And we never got it back in any meaningful way. Well, naturally, our own stockpiles sat rotting in warehouses under Tam's watch, and frontline workers later scrambled for basic protection. This is the pattern: ignorant at best, negligent at worst. They had the intelligence, they had the warnings from their own systems, they had reports from our own soldiers. They had Chinese language media flagging it directly to them. Instead of acting decisively, protecting Canadians first, they downplayed, deflected, virtue signaled about racism, renamed the virus to soften the origin story, and gave away our protective gear. Let's also keep in mind that China has been notoriously unwilling to cooperate fully with investigations into COVID-19's origins. In December of 2024, the U.S. House Select Subcommittee on the Coronavirus Pandemic concluded in its final report that the virus most likely emerged from a laboratory-related incident. Although the origins of COVID-19 remain contested, by the time the first official cases hit Canada in late January, the window to contain it early had already slammed shut. And Theresa Tam was the one holding the keys, ensuring a steady flow of misinformation and instead deploying unprecedented psychological manipulation onto Canadians to control the narrative. Head to rebelinvestigates.com to support all of our exclusive government accountability journalism, and make sure that you like this video, share it with someone who still thinks they did the best that they could, and drop a comment. When did you first realize that something was off? In late 2019 or early 2020? Let me know in the comments. For Rebel News, I'm Tamara Ugolini.